So just checking if I'm visible, sir, and audible.
Yes, you are visible, audible. Yes, yes, please proceed.
Thank you, sir, for that introduction. And let me at the outset thanks the ISCCM National for giving us the opportunity. And it's a great topic and very relevant topic. And for that purpose, it's a philosophical topic. So what actually makes a good nurse as a great one? So this is the topic for discussion today. So before understanding any topic, as we are all bedside people, we work at the bedside of the patient and we strive forward for the betterment of the patient. So it's always better to understand a situation where what does the situation looks from the other side of the bed. So just imagine how does this scenario plays out. If you all can close your eyes and imagine yourself confined in an unknown place with unknown persons who are wearing masks, dresses, they'll be coming and they'll poking you with the needles. They'll take your blood, keeping tubes in you. And you may or may not be able to talk to your loved ones as frequently as you want. You cannot take your food. You'll be in a lot of pain and there won't be proper control of the pain. And you don't even know when to get out of the place and whether you'll go out of this place or not. If you can all imagine this place, if you are there at the bed and if you're in this situation, just imagine how scary it would be. So can you identify this place for me? So as you can see, this is a prison and this is an intensive care unit. So for all practical purposes, for a illiterate patient or a patient who is in a lot of suffering, who doesn't actually care about our medical terminologies and our advanced treatments, both of them looked same to the patient. And so you need to understand how the things looks from the patient side and from the patient's attendant side. Then only you'll become more empathetic, more understanding, and you'll know how to approach the things in a different perspective. So imagine this scenario. This is a very routine scenario, but just imagine that you're at the bedside. You see a patient, a 5-year-old girl is admitted in pediatric ICU. She already had an advanced hematological malignancy. She's in severe pain and multiple lines, needles everywhere. They are pricking the child every time. The father and mother of the child are at the bedside and in tremendous stress. At that time, something suddenly breaks out in the father. He starts arguing with the bedside nurse and bedside doctor that they're not controlling the pain properly, they're not treating the child properly. I believe that most of us faced these scenarios, difficult patients, difficult attendants in the ICUs and in the wards. So suddenly we cannot control the situation, but at some point of time, some senior nurse will come or maybe a senior doctor will come and they'll talk to the patient attendants and they'll calm down and then the situation will be sorted out. What actually is making the difference at this point of time, we need to understand from the perspective of the father and mother of the child. So this is called as having a caring nature, which is the first prerequisite of any good nurse or for that example, any good medical professional. So this patient, as you can see, small girl in tremendous pain, for a father or mother at the bedside, so it will be so difficult to see the patient herself, and the girl is an innocent girl, she doesn't know much, and they all have clarity in their mind that the patient is not going to survive in the long, but still they are hopeful for some miracle to get down. At this point of time, the patients and attendants are tremendous stress. So the only thing the senior nurse has made a difference is she has a different approach than the juniors here. So this is the called as caring nature. So caring nature is nothing but you need to understand the patient's situation from their perspective, not from your perspective. For you, she may be one of the nurse in 10 beds, one of the attendants in for n number of attendants, but for the family that makes a huge difference. The same thing extends to the topic of empathy. So empathy is different from sympathy. Sympathy is where you just show the sympathy towards some other person who is in a difficult situation, whereas empathy, you're actually imagining that you are in the shoes of that suffering patient, then you're feeling their emotions, and then you're doing the service as if you're doing to your own family or yourself. So here these the way you look at the patient, the way you look at the attendants, how do you make them feel, that makes a huge difference. And here if you have an elderly person, small girl, when you give them a hug, small touch, take their hands in your hand, that makes a huge difference, and the patients has the confidence that you are on their side rather than you're just a part of some of the treating team. So caring nature and empathy are the first prerequisite which make a nurse a better one. And I think without these first two qualities, however much knowledge you have, like how many degrees you have, it doesn't make any difference for the average patient. So the same thing, this here the approach is called as IDET approach. Here the senior nurse has followed this approach. Once you go and talk to the any patient or attendant, try to acknowledge their suffering, try to acknowledge their name, their identity. Always try to address them in their name and their identity rather than just as a bed number or a room number. So that creates a confidence in the patient that you are recognizing them as an individual. Then you always introduce yourself in a calm manner, collected manner. Then they'll understand that you are a medical professional, and spend enough duration with the patient or attendant. So the more the time you can spend with the patient, the more the confidence they're able to have in you. And try to explain them the situation in a simpler terms. Try to avoid too much of medical jargon, too many advanced terms. And finally, once you complete this one, then just say a simple thank you with a real conviction in your voice so that they'll feel gratified. So these are all part of communication skills. As you know, as you develop over the period of your career, as your experience goes up, these communication skills you tend to acquire naturally. Here, the difference between the senior nurse and the junior ones is the way they communicate with the patient. So how did the senior nurse communicated here? As you know, is the communication important in the first part? Definitely. When there was a large survey where they conducted and the patient attendants and patients, the real successful nurses are the great nurses which were identified. The patient attendants are the nurses who communicated better, who actually anticipated their needs, the patient needs. Here, the most difficult part for the patient father is to see the girl in suffering of pain. So you need to address the pain first. At least if you could not address it, at least you need to tell them that that some other senior person is going to come and you are going to escalate this matter in a compassionate matter. If you're not going to discuss the specific need and you're going to discuss something else, some other concern, no, it doesn't make any difference for them. And you need to show that all the staff which is included works as a team rather than any separate individuals. You should not go, for example, if the senior nurse goes there to their bedside, the blames the junior nurse there, then that actually doesn't create any confidence in the department as a whole. You should show them that you are a part of the entire team, and you should always respond with the care and compassion. So compassion makes a huge difference. And here, if there's going to be any delay in the treatment, for example, for some untoward delay, maybe in the treatment, food, or whatever it may be, always be honest with the patient and tell them in simpler terms. So we are sorry for this, but there's going to be some delay. Try to bear with us. If you escape the situation and not going to communicate with them, it's going to be worse than the initial part. And try to always be methodical when you're going to give the medication. Try to explain them the indication. Don't think that they don't know anything. You may be overcrowded. You may have a lot of shortage of time, but always try to give respect to the specific patient as an individual. And when we're doing any invasive procedure, we all know that it's a duty of the person who is performing the procedure to explain the procedure and take the consent. But always remember that as a bedside nurse, you are the person who is going to stay with the patient for lengthier time, and they have more confidence in you rather than any other foreign person coming and doing the procedure. Try to explain and clarify them. And pain is going to actually impair the lot of quality of ICU stay or the hospital stay. Always address promptly and try to not belittle them when they're complaining about the pain. So these all things basically comes out as a communication skill. And these are the parts of communication. The only reason why I kept this diagram is verbal communication, as you can see in the top left corner, where you're basically communicating verbally about the specific part, specific pain issue or specific procedure issue, only forms a 1/4 of the overall communication part, whereas active listening to the patient, when you're listening to the patient, that makes a huge difference. They'll understand that you're actually giving them importance, and you can actually understand their pain and their interpretation better. And compassion and delivery, when you say something to the patient, here the senior nurse have delivered in such a way with a compassion, your tone, intonation, your pace of speaking, you need to speak slowly, you need to give some gap. So the way you deliver your speech also makes a huge difference in the way you're communicating. And ultimately, the non-verbal cues, the body language, your body language creates a huge difference. So when you can see these form the 3/4 of the overall communication part, the way you communicate with the patient. So try to develop them rather than only the verbal communication. So you can see in the picture there, just because you tell them that this issue is being sorted out doesn't mean anything. Your face, your non-verbal cues should communicate the same thing. You cannot keep a discongruous face and utter something. And identify any barriers. Always try to see if there's any social barriers, language barriers, and talk to the patient in their own language rather than in your language. And don't make the promises you can't keep. If this illness is going to be a sick illness or is going to be a turbulent period, then tell them very frankly, but in a compassionate terms. So this basically summarizes the communication skills, where you are going to acquire over the period of time. Try to talk to your seniors more and more, try to talk to the doctors, try to talk to the other treating teams, and more importantly, the social workers in your team. So they play a huge role in developing the communication skills. Try to understand the situation of the patient. You cannot behave in the same way with a terminal malignant patient, with an elective patient present posted for PTCA. So you need to have a different approach. So a good nurse or a great nurse has a good communicating skills. So coming to the third important quality you need to have is orientation to the details. Just see this scenario, which is very common in most of the tertiary ICUs. For example, there's a 30-year-old patient, septic shock, multi-organ dysfunction. He's on multiple machines, ventilators, CRRT machines with a high advanced setting, maybe nephroning, is on multiple inotropic supports, NARED, vasopressin, dopamine. At this situation, you can see the picture there, how many pumps he's being connected, how many machines is connected. We do it routinely day in and day out, this kind of situation. For example, there's a junior nurse who at the bedside, suddenly the patient's BP started to drop and the patient's heart rate drops. So what do? The nurse at the bedside, she panics. She don't know what to do. She call for the help. Then the bedside, then the senior nurse comes. Then quickly she'll try to sort it out. What is the approach here she followed? She has a specific approach. See, the core competency matters here. So your confidence, competency, and calmness. Three of the most important qualities you need to have a clarity here. So you can see here, the nurse comes, quickly check whether this BP is real BP or not on the artery line, on the invasive BP monitor on the monitor. Then if the BP is low, the heart rate is low, quickly she'll stop the ultrafiltrate in the CRRT machine, start a fluid bolus, and quickly identify the connections of the vasopressors. She identifies that the noradrenaline, the infusion port is not connected properly, connects it, and over a period of time, slowly the patient status improves. So what is the difference between the first nurse and the second nurse? The first nurse and second nurse, the difference is the second nurse knows where the fault can be, and she has a methodical approach, and she'll know each detail, right from the infusion part to the machine to the patient. Everything is important here. So she has a detailed approach here. You can see the same master chart here in one of the ICUs. You can see the parameters each of the patient has to be monitored here. You can see, as we all know, how many hemodynamic parameters are being monitored, the ventilator parameters, and there are fluids going on. There is a nitroglycerin going on. There is an adrenaline going on. There is an actropid. Hourly, they are monitoring the drains, outputs, everything. So at this point of time, so it's not about the problem solving in that 1 second. It's about more understanding the patient in a whole and understanding and giving importance to the each detail. Here, the each ml of the or each micrograms of the vasopressor is important here. So you need to understand the details. So having a detailed approach or having a methodical approach and giving importance to the each detail, no, they makes a huge difference. And the next important quality each nurse needs to have is having an emotional stability. So this scenario we had recently, you had a major accident involving school bus. Multiple casualties were brought to the emergency. And some of the children, unfortunately, were brought dead. Some of the children were pretty bad condition who needs importance. And so here, as an ER nurse, if you're in that place, no, the doctor has asked you or the senior nurse has asked you to triage the patients. So it's a very emotional situation where you are seeing a small children. To see a kid in that situation is very difficult for any person. And if you have a kids at home, it will be much more traumatic. But the ER nurse calmly, she understood that some of the casualties are already passed away, could not do much about it. Some of the persons are beyond salvage. So more importantly, she identified the persons who are salvageable, and she shifted and tried them and gave more importance to them. And she gave less importance to the persons who are very stable, who are just creating a kind of noise there. So here your job is to have an emotional stability here and calmly sort out this issue. How do you attain an emotional stability? So there is something called as emotional intelligence, like normal intelligence. So you need to have daily sittings with your seniors, try to discuss the difficult scenarios. And in an early part in your career, maybe it will be difficult for you to see these scenarios. But as the day in and day out goes on in your career, so you need to have a objectified mind. So it doesn't mean that you're having an emotional ability. You cannot treat the person with compassion and caring. At the same time, you need to have both of them. So that is a very important quality. How do you develop and how do you develop resilience? Each of the person have a different ways of handling these things. You can have a spiritual mentors, you can develop your competency. Most important thing is develop your competency skills. If you don't know how to assist the lines and tubes in difficult situation, it's going to be much more stressful for you. So core competencies makes a huge difference. And at the same time, develop a team concept. So each of your team has to support the other team member. And you should always be optimistic. Just because you lost one person in your ICU doesn't mean that then it's everything end of the world. So you need to be very optimistic. And there is something called as burnout of the persons who are working in ICUs prolonged time, as we've seen in COVID with numerous patients. No, so you need to have certain methods to cope up with the burnouts. So what is adaptability? The next good quality you need to have. What is adaptability? You can see the nurse here. She has been working in PICU, pediatric ICU, since 7 years. And she's adapted to the kids, keeping the line. She is in her comfort zone in handling the specific age group, specific doctors, her own teammates. Suddenly in the evening, when she arrived at the evening shift, no, she was suddenly asked to go to the ECMO unit because suddenly someone fell short. So what is your approach? Whenever you come to your shift in the evening or morning, no, suddenly if someone asks you to go and work in a different unit, that too, it's not in your comfort zone, it's of a different capacity from you, it'll be obviously difficult for you. So ability to handle these situations is called adaptability. How do you develop that adaptability? Again, you need to develop a holistic competency. You need to be able to handle adult patients at the same time, pregnant patients at the same time, pediatric patients. So you may not be very good in certain all groups, but at least you need to have a basic competency. If you develop this adaptability, whether you go to a different country, whether do a different system, you're going to be flexible and it's not going to create too much stress for you. At the same time, always keep an open mind. Go with an open mind, go with a flexible mind, so that you'll won't be too much of stress. And develop a kind of physical flexibility as well. You need to have a lot of stamina, so which we'll be discussing in the next slides. We all know you are all very hardworking. In fact, if I can be very honest, you are extremely hardworking and more than any doctor I know. And in fact, if one of my patients survives, if any of the ICU patient survives, 90% of the good work was done by the ICU nurse. So we all acknowledge that. But this is not a quality which you will be taking for granted. So you need to develop a habit of hard work right from your student career, and this needs to go on as the time goes up in your career. So if you develop a hard working ethic, no, a good attitude, people are going to respect you. Okay, any person, when you see other person who is extremely hardworking, they are going to respect you. But doesn't mean that you are doing a hard work without any logic. You need to have some clarity in your mind. So do a hard work. You need to have both the physical stamina and mental stamina. We all see nurses attending prolonged surgeries in the operation theater. In fact, when I saw yesterday, one of the nurses, she was going at home at 11 o'clock in the night. And we all have worked in the COVID ICUs, 12 hours, 13 hours in PPEs, wearing the PPEs. Even in the rehabilitation units, when you're trying to mobilize the patient, you need a lot of strength. So you need to have a good physical stamina. And good physical stamina, if you have a good physical stamina, it is going to give good mental stamina as well. There is a very good evidence that both the physical stamina and mental stamina are both related. So how do you develop your physical stamina? Good nutrition. You might ask me, where is the time for taking good nutrition in the long shifts when you're going at home at night 10 o'clock? Yes, we do agree that the shifts are very difficult and the taking nutrition at the right time is difficult, but try to plan something. Try to take small breaks in between. Try to have a good team approach where some of the persons can go and have something and again come back. And even if you're taking small meals or small nutrition, make sure that they have a good calories and good proteins in it. And when you go back to your hostels or go back to your places, try to have a good uninterrupted sleep in the night. Rather than this, one night of good sleep makes a huge difference. And try to have stretching and massages in between. Stretching exercise, it makes a difference when you, especially when you're in prolonged shifts. And try to control your breathing. So this was a habit which was having a proven evidence during PPEs in Italy, and when most of the places, when they initially started PPE, the nurses started to develop a control on their breathing. This is none other than meditation in one part. So try to learn it and try to visualize it. This visualization concept was popularized by athletes like great athletes, Olympic medal athletes, no, where you actually try to, for example, it's been very stressful for you. You are going to have a lengthy shift and difficult shift. Try to visualize it before going to the shift as well. How the shift is going to play for you. What are the things you are going to act, and how you're going to actually tackle them. If you it won't be sudden stress for you if you're going to visualize it. And try to always have a water bottle with you. Make sure that you take water in regular intervals. And if you have a good hydration, your ability to do prolonged shifts will be much better rather than getting tired out. So coming to the other important qualities of the nurses who are really great, good judgment skills. Okay, so the judgment skills is it's not exclusive for the doctors. It is very important for the nurses as well. So just see the scenario. One of the patients was brought in an altered mental status, elderly female. Son found her in the bathtub. She didn't recognize him. She has a fever, very hot, and she is in a bit of altered sensorium as well. So this patient was brought to the emergency or maybe in an ICU. What are the major things as a bedside nurse you need to understand here? What is the judgment skill here? The judgment skill is basically to understand the major problems here, to understand the plan of action, and to initiate the plan of action here. And your competency or your basic knowledge background also makes a huge difference here. So the basic difference the sister has to identify here is that the patient is dehydrated based on various evidence. There's a risk of patient going into the shock. The urine output has dropped. Patient is confused. So at the same time, when any patient who is confused, what does that mean? There's a risk of self-harm as well. And the patient has a poor nutrition as well. So that these, as a bedside nurse, the immediate response nurse, you need to identify these things immediately. So once you do this judgment, then only you start these basic steps from your side. When anyone asks you, if you start charting the patient rather than first starting an IV, it doesn't make any sense. So among these steps, no, first keeping a good wide bore cannula, starting the IV fluids, sending the cultures and giving the antibiotic. These are the ones which are very important at this bedside. And this makes a huge difference for the patient in the judgment skills of the nurse. And ultimately, when you have an altered sensorium which is persistent, go to the CT scan. And ultimately, the next things obviously will go in flow. Right. So this is called as judgment skills. Unless until you identify these previous deficits, you are not going to do these things. And once you judge the clinical situation, when you're transferring this patient from the ER to the ICU, you are going to give the handover like this. Elderly female came with altered mental status. There's a source of sepsis, looks like an urinary tract. And when the presentation, her lactic acid was 3, after giving the fluids, the lactic acid improved. We given fluid, you are going to continue the fluid in the ICU. And we have given first dose antibiotic, please give that rest of the things. So this is the important things you need to give the handover to the patient. We see sometimes giving prolonged handovers, maybe lasting up to 1 hour, where they start from minor details from place, like place, person, all those things. Rather than if you have a short time, these are the more important things which you need to judge, that which are very important for the person, right? So this is called as judgmental skills, which a great nurse possesses. And you need to be very quick thinking as well. You need to develop you need to develop very fast reflexes, right? So on one of the day, these are all real scenarios. So the nursing supervisor, when doing the rounds, patient was complaining small dizziness. She could actually go and tell a junior nurse to see the BP and go away and do some things. But here she did do that. She went and observed the pulse, and she found that the pulse is on the lower side. What did she do here? She took an ECG, and obviously there's a complete heart block. You may or may not interpret the complex ECGs, but here your job is to identify the ECG patterns where they can actually kill the patient. So immediately the doctor was called and the patient was shifted to the cath lab and the pacemaker was kept and the life was saved. So the point here you need to develop is you need to have quick reflexes, never neglect any small thing on the patient's behalf, and always anticipate the things. If you anticipate, then you're going to solve it. If you cannot anticipate, you are not going to solve the scenario. And very important nowadays, there are 2 types of working. One thing is to lead by the example. Other thing is just to follow the leader. Always try to be a leader, right? If you be a leader, no, you are going to develop and you're going to bring up your team as well. So just an example here, Ms. Jessica has joined as a new superintendent. She joined in a very new unit, new hospital as well. But as we were in 2020 experience, within few days, suddenly the COVID cases started coming. Then there's a huge pressure from the hospital to take care of these patients. We all have faced these scenarios, right? What are the hurdles she's facing? She is a new person to the setup itself. So that itself is a hurdle. She needs to understand how the setup works. She don't know the team completely. And the team is not completely very experienced team. They may not know much about the infection control practices, about the COVID. Everyone is afraid of COVID at that time. And once you started taking cases, the staff are getting infected and they're going into quarantine. And the persons who are at the in unit, they're getting burnt out because of huge caseload. Suddenly, some of the team members are disappearing and they're going to home. So these are all real scenarios which she faced in the initial part. How did she handle these problems here? She first thing she have done is she acknowledged that there's a problem. When you acknowledge that there's a problem, then only the answer is going to come. Then she took a pen and paper, make sure that who are the team members, what are their strengths and weaknesses. This is called as SWOT analysis: strength, weakness, opportunities, and improvements. So once she analyzed the strengths and weaknesses of the team members, so she identified 1 or 2 good nurses who can actually handle pressure better, who communicate better. She kept them as a seniors and the in-charge nurses. Then the second, third, one of them will be infection control. One of them will be taking care of the infected nurses. So she developed a rapport with the doctor. She developed a rapport with the operations team. So over a period of 1 month, when you are strong in your stance, no, slowly the situation comes under the control. And after 1 year, the handling of this entire problem, she became a real leader. She was a leader to start with, and people really respected her. And she is a topmost leader in her field. So she has benefited, her team has benefited, the hospital has benefited, and the patient has benefited. So this is called as leadership skills, which is very important for any nurse, and decision making. So you need to be a person who is a decision maker rather than indecisive person. Okay. When just like the previous scenario, when you're doing this decision making, you need to explore the alternatives. Among them, you need to choose the reliable alternatives. Once you implement this decision, again, you need to go back and audit the results of the implementation. Once you do this regularly, this becomes easy for you and your system works, right? So once we have discussed the serious qualities, no, more humorous qualities. Okay. So this is called a sense of humor. We all know our medical persons, whether it's a nurse or doctor and any other paramedic, we have a different type of sense of humor when you compare with the non-medical persons, right? So we regularly see day in and day out death, loss of limb, morbidity, all the painful things we regularly see it, and we handle with so much of pressure. You can handle all these things only if you have a sense of humor. Okay, try to find the sense of humor in even the most difficult parts of the day, even the darkest places of the day. Okay, just because you have a sense of humor, it doesn't mean that you are making the situation light, but you are actually trying to cope with the scenario. And the sense of humor, you have a lot of resources, you have various books, various journals with a lot of jokes. Try to have it develop and try to always joke around in your team. Try to have this is one of the very good way of coping up with the stress. And very important, and most of the junior nurses asks us, how do you manage the time, right? You have the senior nurses who are actually very calm, collected. When there's on the other day, one of the night duties, there were 3 or 4 like code blues in the hospital. In ICU patients, through 2 or 3 patients were suddenly deteriorated. The nurses who are at the in charge nurses, they're handling it very calmly, whereas at the junior nurses who are recently joined, they're getting stressed up. So what happens if you can't handle the time? So your shift gets prolonged. The person who was supposed to go out of the shift at 8 o'clock in the morning, so you tend to not chart the master charts. You tend to not sign off your medication charts. You forget about giving the food to the patient. Then slowly that shifts prolongs, and the person who is supposed to go at 8 o'clock goes at 10 o'clock, still with an incomplete patient routine. And even if she goes, there are a lot of lacunae at that time, and you're again called back from your hostel. You will ask to fill up a lot of the vacuum at the signatures, all those things. So how do you basically handle that time? So time is very precious. To handle the time, you have these 3 tips. Okay, so the best nurses handle very good time management, and they have their own personal space once they go back from the hospital, and they have their own life. Okay, if you can't practice this time management, it's going to be very tough for you. How do you do it? These are 3 terms: organization, prioritization, and delegation. Okay, organization is first you organize your activity. Once your shift starts, maybe they have given you 3 patients. So try to take a pen and paper and chart out the activities you need to do it over the night. Among them, you prioritize it. Okay. So for example, one patient is on ventilator. Your job is to do regular suction, maybe give a rail tube feeding, which are more important ones. And make sure that you tick it off in your own rather than the only master chart. Try to develop a habit of doing that, and make sure that you gather all the supply. For example, you have a ventilator patient, you'll be requiring suction cats, cathy kit, or maybe you have a patient who is about to be intubated, you require a boozy, all those kind of supplies. You anticipate in the shift itself and try to indent and keep it in the impress stock, so that when the real situation comes, you are not going to be stressed out, right? To develop this, 2 habits you need to develop is having the knowledge about the patient and the anticipation, and always break down the tasks into smaller ones. Okay, if you have a long task, try to break it into the smaller parts and try to delegate it to the juniors as well. If you are the shift senior, try to delegate into the smaller parts and try to give the less stressful ones to the junior nurses. So this way, you're going to teach them. At the same time, you're going to cut down the stress on yourself as well. So which is very important for the time management. Prioritization among the, if you have a very less time, priority like airway handling, sick patients, these are the more priorities. And here, what are the barriers in not doing this stuff? Not doing time management? You see you see junior nurses getting very stressed up, no? There we see people crying without the time management. The problem here is they are not able to plan it properly. And you know about success, how to organize the your unit. Try to avoid the clutter. Okay, try to keep each equipment in its own place. Try to keep your emergency medicines in its own place. Try to avoid unnecessary activities. Okay, so these things, and multitasking. Never try to do a multitasking at the same time. Okay, try to delegate each of them. If you do these things, you are going to manage your time very well. And last three good qualities of the person for any great nurse is, you should be a good manager as well. Just you see nurse managers as well, which is going to be the future. Who is a nurse manager? Nurse manager is basically a combination of an executive as well as a nurse. So she can do the nursing at well. She's basically a liaison between the nursing director and the ground level staff. And what are her responsibilities? Her responsibilities is making sure that the unit functions in a proper way. Staffing is in a proper way. Is there an employee satisfaction? Is there any difficulty from the bedside nurses? Is the customer is satisfied? And is the budget? For example, the nurses need something, or the bedside there's a need of something, she is able to escalate it to the nursing director and to the operations team. This is called as a manager. And future there's a role of there's a huge role of these nurse managers. So you need to know how to manage the things in your unit as well. And it doesn't go with without saying, see, when you are a nurse, it is your job to teach and educate your colleagues, especially the junior colleagues. So you need to be an educator as well. And unless until you publish, so there is a physical wealth and there is an academic wealth. So the people recognize you based on the research you do, right? So how do you become a good nurse educator or researcher? You need to develop a habit of reading regularly. Try to develop good new maneuvers, develop nurse curricula, and try to always talk to the juniors and see what they need at the in the education part. And once you do it, people respect you, and you can go to the much bigger levels. They'll take you as a policy developers, evidence-based medicine, all those things you can do it. Okay, so this is a very important quality in the future. And you need to have a lot of good publications. And the great nurses, well-recognized nurses all over the world are ones who had a good number of publications as well. And the last important quality, but not the least important quality, you should always protect the patient. Try to maintain a safe environment. Okay, just because the doctor has ordered some procedure, some difficult procedure, doesn't mean that it is a necessary step. So you can always go and contradict if you think that this particular medicine or particular procedure is going to harm the patient. No, just an example, you know that there's a terminal malignancy patient. The patient has a clear do not resuscitate order, but the duty doctor is going to either way go and intubate the patient. You need to stop there, because your duty lies with the patient. Okay, the patient trusts you with their life, and you need to protect them in all parts, and you are basically a clinical advocate for them. And this again, when you're not giving a medicine which is actually patient having an allergy, that you are protecting the patient there. So your most important quality is protecting the patient, especially the vulnerable groups like elderly people, pediatric people, or dependent people who are not able to move. So you need to protect them. So to summarize it, nursing is not for everyone. You are all great heroes, and you are doing a great job, but you can always have a potential to become a great one from a good one. So a great nurse is always very empathetic, She has a very caring nature and compassionate nature. She always gives very good importance to the small details, because each detail is important for the patient. Very hardworking person, has a good physical stamina as well as mental stamina, and she or he is going to be very emotionally stable. So they are not going to be crumble with small circumstances, however much that shift is going to be difficult. They manages the time very effectively. She or he is going to protect the patient at all sorts, and they are going to be the leader for the team and leader for the hospital on a larger perspective, and always have a good sense of humor. Try to not lose this good sense of humor. Thank you so much. And we can, as a doctor, we cannot do the stuff, you can do it, and hats off to you. And having this job as a nurse, no, it is not a simple job. It is a great opportunity for showing a kindness to the another patient, where you are saving a patient and saving the family as well. So try to make avail of it. Thank you.
Thank you, Deepak, for a detailed and wonderful presentation. I think a lot of thought process has been put by the Deepak, a lot of brainstorming things, and gone in the quite depth of the perspective. Because doctors talking about a good nurse or leader nurse is not an easy thing. Because unless and until you think of the same role as a doctor when you are a nurse, what to be expected for a good nurse, I think the Deepak has imagined for himself, for being a nurse at the bedside, what qualities we want for that person. I think then only it will come out of the thought process that what makes a good nurse. I think he has took a lot of points for a nurse. Any person cannot become a nurse. Very important for nurse, the better qualities for the nurse for the personal level, the academic level, and the managerial level, and the some of the administration level. So that he told very well, when we are coming to the healthcare industry, is very important to have maintain your good health. So that very important to give concentration of your health. There's no need to tell. He told a lot about the personal health. We should never neglect about the personal health, because what we tell, we want to become a lambe reska ghoda, not a short reska ghoda. When you want to become a lambe reska, the horse is there, so that we have to have the understanding, the empathy, the patience, understanding, taking care of the people, respecting the other people opinion, what is there, respecting them, talking to them, cool, calm, controlling your emotions, controlling your anger. All things are very important. And always we have to use I, change I to the we. That makes a lot of difference. When we tell we are doing it, that makes a lot of the message given to the patients and patient family. Not only one person is involved, the team of the people is involved. Other thing, smartness is there in the present situation, how to handle when some crisis happens for the patient, to point out where the particular problem is there. Whether the problem is there from the patient side, because of the machine side, or the medication side, or something else problem has came for the patient. The other important thing about the communication, not only the communication between the colleagues, communication between the medical fraternities, and communication with the patients and family. I think all these angles are very important for the communication, not only keeping the information for yourself. When the information is important, information given in a proper way at a proper time, with the content, what important things are there, that is very important. And at the same time, when something is not there, with the patient getting a cardiac arrest, we can take a leadership role also. And the other important thing is there for the nurses in our place also. Every occasion comes, you try to celebrate, is very important. As happiness is there for getting small things. When the sickest patient comes out from all things are there, we feel very happy. We should celebrate as a team, both medical professional and even the nursing professional also, because a lot to achieve in the life, but the happiness will be there for the small things. Something you do a successful procedure, you are able to handle a difficult relative, you are able to handle and take care of the patient without the bed sores, without thrombophlebitis, without infection for the patient. That is also a great achievement for the nurse, particularly in the intensive care unit. Other thing, as I told about, Deepak told about the time management, because we are having some 6 hours duty, 6 hours, 8 hours, or 12 hours duty is there. We have to divide the time. What is priorities there? Some of the people are only busy with the documentation. They are writing only. They're giving the medications and not doing other things. I think the time management is very important. So that reason, priority has to be given. And not only the things what you are keeping with yourself, the education and spreading the knowledge to the colleagues is very important. With this, we have some MCQs to discuss. Whatever the people for last 45 minutes, what Deepak has taken a lot of effort for presenting this topic. We can put some MCQs, Deepak. Deepak, you are mute.
Yes, sir.
Mute.
So one of the student has risen his, I think, hand, I guess. So, sir. So go ahead, sir. I'll be changing the slides. You can ask the questions. And the students can type the answers in the chat box.
Yes, yes. So that some of the what we discussed for last 40-45 minutes or so, Deepak has told, so that we'll see how much the attention is there and how much the general knowledge is there about the specialty of the medical field and even the nurses. The first question, what is there about the define the nurse according to WHO? You can type your answers in the chat box so that we can check your chat box and we'll inform and we discuss that things also. So that we'll wait for around 15 seconds or 20 seconds till we get the response. Define the nurse according to WHO. I think nobody has put anything in the chat box. We'll go to the next slide, Deepak.
Yes, sir.
So that what we discussed about for last 45 minutes and so, the nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups and communities, sick as well as in all the settings. It includes promotion of the health, prevention of the illness and the care of the ill, disabled and even the dying persons also. Okay, so that your role is there for the prevention, the treatment and even for the palliation care also. That not only because this is the forum of intensive care, not only the sick patients, but you have to take care of the dying patients. Counseling, prevention is very important. That is the definition of the WHO. Next slide. Next question. Now is very important. This photo, I think, is this if you see this picture, it became a quite viral. The identify the great nurse. It is from India. Most of the times we are discussing from the Western world what is happening. What is the name of the nurse, from where she was there, and what happened to her. I think somebody has put here the answer as
She. Yes, sir. They
Sister Lini.
They answered correctly.
Yes, absolutely correct answer. She was the Sister Lini. Next slide.
So she was the Sister Lini, who's a great person who sacrificed her life for during the Nipah virus epidemic, husband and young kids. So we need to remember our own heroes from India. So that's the reason we kept it this one.
Thanks. I think somebody is remembering for the Lini sister, her Lini Putseri, who was the hero while dying during the taking care of the Nipah virus breakdown happened in the Kerala in I think 2018 and 19, and subsequently we had all these things. And always you're remembering the heroes from the Western country. Is important to remember our own people who has contributed for the growth of our organization or the society in India itself. Next question.
She was awarded with the Florence Nightingale Award by the Indian government also. So
what are the qualities of a good nurse? What we've seen in the last 40-45 minutes, Deepak has told about the decision making and the guidance is important. Conflict resolution and effective communication, change management or adaptability, commitment to the educational and professional development. You can put answer in the chat box. Decision making and guidance is very important. Conflict resolution, Deepak has shown the case of a young boy, but the conflict was there, and the communication, he told about verbal communication, non-verbal communication. Change the management and adaptability. As the situation comes, you have to go forward. Commitment to education and professional development. Education or academics, always the silver lining to the personal growth of the person. I think some of the people are given the answer about A, B, C, D, and all of the above. Actually, the answer is about the all of the above. The reason You are seeing a person as a holistic approach, okay, and not as an individual thing.
Sir, I think some of them are raising their hand. Can we give them the opportunity to talk maybe?
Yes, yes, definitely, definitely.
How to do that, Dhaval?
Dhaval
Madhulika,
has to.
give them the control, I guess. Can we do
Dhaval,
that?
Dhaval, you are able to hear Dhaval?
Okay. If possible, we'll do it in the last set. Otherwise,
Okay. I think Dhaval is unmuted. Dhaval, those who are people are doing the raising the hand, can we ask them, give an opportunity to talk to them?
So the reason behind that we don't do that is because some of them just raise their hands, sir. So we do not
Oh,
know whether they want to answer a question or they just, because at times they're using it from the mobile, so they just raise their hands.
no problem. No problem. Then, if there's anything, please type in the chat box. Yeah.
next question. Now it is very important. When is the International Nurses Day? Is 11th of the June, 11th of the May, 12th of May, or 12th of June? I think recently everybody has celebrated the Nurses Day. Which date was there?
I think most of them are answering it, sir.
I think most of the people answered as the 12th May.
And you can actually type why it is the celebrated as International Nurses Day also.
Can be any reason is there why that particular day has been selected? Why not the other day in the June, July, other month?
Yes, I think.
Yes, that is correct. Okay, Florence Nightingale, the birthday was there of the 12th of the May. That was the reason it was celebrated as the International Nurses Day. I think good, nice. Next. What makes a great nurse? Nurse should be competent and compassionate. Nurse should be skillful. Nurse should be commanding, and nurse should have a leadership qualities. So that what makes a great nurse? They should have compassion and competency for the work what they are doing in the field. They should be definitely skillful. They should have command and a leadership role. When the situation is there, they should take in your hand, like a CPR is there, so that somebody has to take the lead role and coordinate. I think most of the people.
Among them, which is the most important quality?
Most of the people written as all of the above.
But if you have one of the choice, what are you going to do it? Which is the most important one for any great nurse among all of them? What is the first quality which we discussed? First quality which we have discussed.
Now, most of the answers came all of the above. My answer is coming A, C.
Now that we have given a clue, then sir.
And even B.
So the competency and the compassion, which is the most important for any nurse. And if without it, I think all the qualities are going to be nullified. So if you can't have a compassion for your fellow human being, and if you're not competent in your core subject, okay, so it is going to be futile. However much the leadership you're going to have, if you don't have a compassion and competency, without compassion, your patient is not going to respect you. Without competency, your fellow colleagues are not going to respect you. So both are extremely important.
Okay, we'll go to the next question.
I think they're
I
going
think that everybody should be able to give the answer. We no need of giving the choices. Who's the famous nurse? I think answer given the previous questions only. We'll move to the next. Most commonly used model of care in the ICUs is functional nurse, team nursing, primary nursing, or total patient care. The most commonly used model of care in the ICUs, whether a functional nursing, team nursing, primary nursing, or total patient care.
So there are varied answers. Some of you have answered B, some of you have answered D. So some of you are answering some other things as well. So the answer is total patient care. Okay, so you have various nursing models. Total patient care is there's a full independency where one registered nurse is going to take care of the patient as a whole. She is competent in all the various spectrums, whereas other nursing models are where each of them separates. For example, nurse takes a leadership in one of the nursing model, where unauthorized people, they'll be keeping with the handling with the IV cannulas. Somewhere there's a hospice model, this kind of stuff, but most of our hospitals follow the total patient care model, where one nurse is competent enough to handle all the spectrums of the patient care, and that will be actually much proven model, where it gives a complete control for the registered nurse, as well as it better for the patient because they're comfortable with one nurse. So close.
Okay, so that is very important by the Hunter paradigms. You treat a disease, you win, you lose. You treat a person, I guarantee you will win no matter what the outcome is there. That important thing is there, particularly the nursing care, not only the patient how comes out or become a positive morbidity or mortality, but important thing is there whether required for that patient everything has been done or not is more important. Sometimes outcomes are not in our hand. That the what we discussed about the various qualities for being a great nurse when we are working particularly in the critical care units is very important to keep all these things in the mind. With this, I think we discussed for last hour and so we had a good response for the questions and answers also and participants also. With this, I once again thank you, Dr. Deepak, for presenting a wonderful topic, giving a lot of thought process. Thanks to the ISCCM, the central, regarding the step nursing courses, they are running very well. Every week it is happening with a new topic, with a new thought process, and a lot of people are getting benefit and advantage. Those people not able to watch now, even that is available on the online also. With that, we thank you everyone, and we declare the session is closed. Thank you. Thank you, Deepak.
Thank you, sir. Thank you all the nurses for having us and for your patient listening. And thank you, ICCM. Thank you, Shyam Sundar sir, as well. And hats off to you for being a great nurses.